everyone. Welcome back to the Healthtech Pigeon podcast, your go-to place for the latest in health tech news and insights. I'm Belle Taylor, and today I'm joined by Harry from SomX, who I've managed to strong arm into doing this in his second week at the company. So welcome to the ship, Harry. How are you feeling?
Thank you very much. I'm very excited to be on.
Consider this kind of your dump into the fire of Healthtech Pigeon.
Dive in at the deep end.
Exactly. Hopefully no fire or deep end today. We're going to discuss some really exciting developments from wearable tech to an AI report gone wrong in Australia. But yeah, how's everyone's weeks feeling so far? I personally, if it can be summarised by anything, I'm at my wit's end. And today I asked the entire SomX team if they'd accidentally booked a haircut into my calendar, only to find out about an hour ago that it was, in fact, my own haircut. So we are hanging on by a thread.
It's been a great saga.
The saga of the haircut. Adam, our producer here, has had the saga of the lost lip gloss this week, which has also been solved today. So a really big day for solving mysteries at SomX. Anyway, Harry, don't think that we're always this disorganized, because I promise you it's all good normally.
I'll have to give an update in a few weeks' time.
Exactly. All right. Well, we've already discussed all the great stuff about kind of what is a millennial meme versus a Gen Z meme. So all that's left to talk about today is the health tech headlines. So let's dive right in. First up, Oura hit an $11 billion valuation after its $900 million Series E. Oura, who are known for their smart rings, has just hit the valuation after its latest funding round, bringing it to more than double what it was just a year ago. The company, known for its kind of wearable ring that tracks biometric data, is rapidly scaling, with plans to hit $1 billion in revenue by 2025, signalling a growing interest in preventative health and the role of wearables. I'm really interested, Harry, as to where you stand on the wearables thing. Like, I personally am not a wearables fan. I don't have smartwatches, or I can get on board with the idea of a ring. Although as someone who has an eczema flare up at the slightest touch of something that gets my hands, I won't be jumping onto the bandwagon. But are you into wearables? What do you think about them?
Yeah, I would say I'm a bit of a wearables nerd, to be honest. Like,
lovely.
I wore the Apple Watch for about, 5 years or so, and recently switched over to a Garmin watch. So I'm very interested in all the data collection and all of the insights that you can gather from these devices, but equally understand people who aren't interested in them. And Oura it's a phenomenally interesting story, and the fact that they've reached this valuation is incredible. And it also signals some interesting signs of like where the industry is moving, and also raises concerns from my perspective as well about where this is going. Reading behind the headline, they were sort of talking about how they're looking to move towards like preventative healthcare models, and that very much moves into the medical device area, which they're already, I've seen reports or some stories about them already sort of crossing into that and having to move back a little bit. So yeah, that's
it's an interesting blurred line, isn't it? Like, where does interesting health insights end and medical devices begin? Because at the end of the day, like, knowing anything about your health could be considered preventative health. Like, considering your vegetable intake and upping it could be a preventative health move. And you don't necessarily need a medical device to tell you that. But yeah, when it comes to capturing, those metrics that could kind of allow for kind of more serious medical diagnoses or interventions, then it's an interesting boundary, and one that we talk about a lot on the podcast. And, these companies are coming up against, like, Oura. The premise is really interesting. Is how do we turn a wearable that's a bulky watch into something sleek that a user who might otherwise be against wearables would wear? Now, that's a great thing. It's the idea being that it's not something which is going to get in the way of your life. It feels very discreet, yet you can find out about your sleep, about your stress levels, about kind of various things like that. It's an interesting concept. but obviously has clear intentions. But yeah, the way the kind of stuff it's showing has obviously got huge promise for kind of health tech and preventative healthcare. I'm interested as well. They said that they're trying to move away from the gym bro market and really corner the woman's wearable market, which makes sense. It's a ring, which I also find quite interesting because the ring itself is actually very masculine looking. I can see it more at home on a man's hand than a woman's. It's quite big. Even the smaller ones are quite bulky. They tend to be quite like a strong metallic finish. Again, to me, they don't necessarily read as feminine. So it's interesting that they're going down that boundary as well, because why not just stick down the middle and say we're gender, inclusive?
So something else that's interesting about this as well is I actually saw one of the co-founders of Oura speak at Health Europe last year, and he was talking about how they've been trialing or using Oura rings in clinics in the Middle East and rolling them out to provide like personalized medicine for people who are undergoing different treatments to help track their progress. I might be, don't quote me on this, but I think it had something to do with diabetes, looking at like diabetes treatments. And that's an interesting model to look into, because also if we're talking about the UK, depends on where you're looking at in the world, but that's not the kind of model that applies to how we do stuff in the UK. Like the NHS isn't going to be giving people out Oura rings to do like personalization, but it does show an indicator for perhaps how these tech companies are going to try and embed themselves into like healthcare markets around the rest of the world, perhaps, or private clinics here in the UK.
Yeah, it's interesting. We talk a lot about, and we've talked about this in events as well, about kind of the idea of what wearables can allow for in the healthcare ecosystem. And obviously what they can do is really empower an individual user with insights about their health. That's a given. And that's amazing, especially in a pressured system where you might have short appointment times and you're stressed or worried. Like coming in with things you can point towards and data is a wonderful thing. A more interesting question is, as you've just said, how that actually plugs directly into healthcare systems. So instead of going sort of via the patient, goes directly to the doctor or directly to the clinician, so that they can look at that and sort of see, oh, actually, I've noticed a change in X. Let's look into Y as a result. But I mean, there's also sort of like, it's not a limitless thing. It's a wearable ring. It can't track everything. It can't track it can't. I mean, I would be very interested in diabetes, like what it's measuring in that scenario, because, usually, obviously, you have like continuous glucose monitors or anything. Are they building that into an Oura ring or similar? Because the second you're doing that, you're right, it firmly steps into medical device territory very quickly.
Equally as well, so for example, Apple have this year rolled out their hypertension detection system in their Series 11 of the Apple Watch. And again, it's the heart rate is one thing, but being able to measure something like hypertension, for example, from a non-medical device, it's really blurring the line of, can you use these things for diagnosis, and is that actually useful information? And that applies directly to the Oura ring as well. And you've got a very good point there about like, what more are they going to be adding here? And it, from what the article says, there's a lot of mention to these artificial intelligence features, which again makes me think of medical device territory, trying to tell people about more advanced AI offerings. Like, they've already got this sort of foundation. Going more advanced than that leads me to think of like these other areas of health.
It's interesting, isn't it? Because an AI add-on it's not capturing any more data, like you said. It's based on the same data that it's normally tracking. So an AI add-on shouldn't change its device status in any way. It's just another method of analyzing that. And I guess most users using these things, and you'll have a better insight of this as a wearables person who presumably has looked at the Apple dashboard, the Garmin one, you'll be familiar with receiving insights in different sorts of formats. I guess AI in that sense is probably just a different way of digesting and presenting that information back to you in a way that the user can action or can feel empowered by.
Absolutely.
It's when it's coming in to make decisions, that's obviously where the really tricky territory starts.
Yeah, and I will say as well that that's something that Aura is very well known for, is the presentation of information to the users. It's a very it's a very polished experience. So
as it should be.
Yeah, exactly. So yeah.
What sort of things do you like when you are like looking at wearables? Obviously, it sounds like you've got quite a history of them. You've made quite an educated decision as to upgrading to a different system, whatever. Like, what's important to you?
What's important to me is for personally, it's when I'm looking for something new, was looking for more sensors and more functionality to be able to measure different aspects of my health. So, for example, I had an older Apple Watch, and with this, I had more functionality for things like skin temperature and heart rate variability, which can be used to monitor stress and also just activity performance. So for me, I'm very interested in what I can measure, being able to measure more, and also how the platform works. One of the reasons I haven't gone for Oura is because of the subscription model they have. I want to know that if I have something that I'm going to be able to use it almost indefinitely.
You've paid for it once. It's a sunk cost.
Yeah.
Yeah, I find even things like Peloton feel like a bit of a scam in that sense, because you're paying thousands of pounds for the actual machine and then you need to subscribe to actually access the things. Yes. And you're like, surely for the amount that you've paid, you should have access to that. And presumably at some point you need to replace the equipment anyway. So at that point, raise the prices at that point if you feel like you've made a loss on the class model. Yeah, it's an interesting one. Are you sporty, or is it for an exercise thing, or is it just health optimization for you?
A bit of both. I wouldn't say I'm overly sporty. I like to go out for walks and go out and about, do cycling and whatnot. But I'm not or go to the gym, but not really really sporty. No.
Well, it's good to know. If nothing else, just for SomX, I think we literally divide straight down the middle as to very sporty or not at all. So okay, nice to have someone in the middle.
Oh, yeah.
I am definitely on the not so sporty side, although I wish I was. I feel like if I wore a wearable, it would just be very stressed, needs a haircut.
Well, I guess that was my thing as well this morning. I replied to Belle when she mentioned that she needed to get her hair cut, and I was like, oh, that was me that put the diary in as a bit of a joke, and I was like, actually, I do need to have a haircut, so exactly, I'll take you up on the appointment.
These things happen for a reason. Brilliant. Okay, so we've talked a little bit about kind of the grey area of medical device territory. One of the other things that often comes up when we're talking about wearable devices and personal data and things like that is privacy concerns around data and kind of how that affects both user adoption, and also if they are looking into sort of health prevention, how that data is going to be plugged in with or shared with other providers of maybe healthcare or other device manufacturers or things like that. What are your thoughts here when it comes to, well, both as a user and as someone working in the health tech space? What are your thoughts around kind of what these companies should be thinking about when they're considering scaling, increasing their user things, and scaling across different geographies that are going to have different data concerns and different kind of data policies as well?
Yeah, I'd say it's, as these technologies become more and more capable of measuring different aspects of our health, I think it becomes more concerning from a data privacy perspective. So, for example, it's one thing them having things like your heart rate data, what can you really tell from that? But when they have access to location-based data on where you're doing your activities, your menstrual cycle, and things like that could actually be tied in, or risk scores for certain things like cardiovascular hypertension, for example. Certainly in places like the US, where there's fears that these could be used for insurance purposes or sort of social scoring, those kind of things. So I think that's concerning. And with the the size of a company like Aura, who's grown so quickly, it's hard to believe that they have the systems in place to protect this information, especially like you said, when they're going to be expanding across so many different countries and trying to tailor to all of their systems.
I mean, I'm sure obviously they'll have robust sharing practices in place. It just, I always wonder, you've just mapped out a scenario where sort of an individual has all this different data coming in, potentially from different devices. So you've got the Aura stuff around heart rate and things like that. You have your period tracking app for your menstrual cycle, not yourself personally, obviously. You have your period tracking app for things like that. You might have a Garmin for more exercise related things. Like, you've got all these different devices feeding in. What would concern me, and this again, I do speak as someone that doesn't wear wearables myself, and maybe this is one of the reasons behind it, is I remember when recently, well, every woman who uses a period tracking app will be able to tell you some sort of story that everyone will have received some sort of notification from whatever app they used, talking about their privacy, because obviously in the US right now, there's a lot of narrative around the fact that doctors are able to kind of access your medical, like your menstrual data to sort of, or like the police are enabled to sort of see if you've like illegally sought abortion and things like this, which should be very private information. Now, I have no doubt that the apps that you're using are very robust in their data sharing practices within the app. But when that's plugging into another app, I worry about the user as to what does that like. Does Aura, for example, have the same robust practices in place for data that is not their own? And again, I'm sure that agreement is like rock solid, but it's just something that I'd personally need to feel it really like explained to me, so that I'd feel comfortable with that as a user. So it's an interesting one. It opens up lots of conversations. But this is, no doubt about it, a really, really special moment for health tech. Like, when you think of health tech, your mind immediately goes to sort of physical objects of health. And a ring that captures your health data is, oh, we've got a visitor. Hello, lovely. A ring that captures your data is, such a wonderfully evocative way of capturing those health metrics. And it's really exciting to see Aura's success, I think.
Yeah, and I'd say as well, I'd say consumer products are what comes to the front of most people's minds when they think about health tech. And I think it's a very thought-provoking signal of the market about these wearable products. So yeah, I agree.
And it's lovely to see as a standalone company as well. It's not Apple rolling out a health product. It's not Google rolling out a health product. It's a standalone company doing amazing things. So long may it continue. And I look forward to talking about the Series F. Yeah, and you're a European company as well. Exactly. Yeah. It's a huge success story for them. And so many congratulations to the team. We're really excited to see what happens over the coming years. No doubt it'll be exciting. All right, let us move on to story 2. So Hello Heart, a digital health platform focused on heart health, has just launched an AI assistant named Nia to help with medication management for people at risk of heart disease. The suite of tools, which includes a connected pill box and AI-driven support, aims to improve patient compliance with hypertension medications, a major risk factor for cardiovascular diseases. With heart disease being the leading cause of death worldwide, Hello Heart is hoping to reduce hospitalizations and save costs through better medication management. So here's a great story, and I mean, a good second mention for cardiovascular disease today. But their AI assistant basically aims to improve medication adherence. So one of the things with managing your health if you are at risk of heart disease is, regular use of medication. It's why you always see people with pill boxes and you think, do people need the reminders? But yes, they do. So the interesting thing here is it's using AI to sort of support with that. So people don't have to rely on just the box. They also have kind of AI helping with prompts and things like that. So this also alludes to the fact that one of the biggest challenges with medication adherence is that patient and engagement. So it's not just adhering to it, but it's engaging with your actual kind of medical health plan, making sure that you're empowered to take your medication and you feel good about it, and it's not just a thing that gets ticked or doesn't. And an engaged patient is always going to be the priority. So Harry, I'd love to know your thoughts here on here's a really nice, it's a nice story about a physical object and an AI like element working in tandem, much like the Oura ring to a certain extent, but this one has a very clear medical device claim and medical usage. Would love to know your thoughts here and how you think this is going to support chronic disease management, maybe more broadly, like its uses within heart disease and outside of it.
Patient adherence to medication and keeping up with a regular schedule, I'm very aware that that's a significant challenge, and it doesn't just go for medication as well. It comes for people engaging with appointments and just taking care of their health. And I think coming up with novel ways that we can try and encourage people to interact or engage with their health is really important. So from that perspective, I think it's really interesting. But at the same time, I'm not sure about how important artificial intelligence is in this particular use case for like medical, adhering to like medication. I'm interested to know a bit more about how the system actually uses or implements artificial intelligence, because I think it's a real challenge, but it's whether that is the best way that we can, try and encourage people to take care of their schedule.
Well, I'm reading the article, which is published in Fierce, and it actually to me seems quite interesting. So the suite of tools includes that connected pill box I mentioned before. It also has a blood pressure monitor. It's got the app as well. So it's a whole suite of tools that are sort of connected through this platform, which has an AI agent in it. And then sort of the third element of it, so there's the kind of AI assistant and then there's the platform, but it also has chart reviews of high-risk members' health records by pharmacists. So those health records are part of the platform, which is really interesting. And it says here that the AI assistant, in addition to obviously prompting you to take pills and things like this, will also advise members when they should connect with a physician. So it's basically kind of utilizing. Oh, sorry, there's another cat. It's the same cat, but she's come up again. So yeah, instead of just saying you need to take this, it's able to sort of monitor, your heart pressure and things over time and say, look, there's been a change. You should go seek support from your clinician, which I think is quite interesting. And the platform itself has got lots of data on it from clinicians themselves, and they're involved in the testing of the thing and stuff like that. So
yeah,
here AI feels like it does have a place, if I'm honest. Like there's various things going, and it's a way of how do you connect these things in a way that's going to be easiest for the actual patient to engage with, but also connect into the medical professionals in a way that's not going to bombard them with stuff, but at the points where they need to connect with patients.
Yeah, absolutely. And I think it's actually also, with the additional context of fitting into more of a care ecosystem of devices there, it's very empowering for the patient as well, enabling them to glean more insight, or not necessarily insight themselves, but to have more comfort in the support that they're getting, that they feel like there's more that's being done to monitor their progress, and they're more in touch, and they feel like they're getting a more personalized experience. And I think there's probably an aspect of it that's quite interesting, and for some people probably exciting as well, to be using technology such as that, which I think helps massively. And equally, it reduces, I would imagine, the burden somewhat on healthcare services to have people with more autonomy and perhaps not having to come in for a checkup when it's not absolutely necessary, because sometimes it's very difficult to know, or it's impossible to know, whether someone needs to come in for a checkup essentially. They might come in and there might be nothing that needs to be done, and you can monitor that more effectively.
Yeah, it's interesting. Yeah, I love the fact that kind of monitoring patients' health records is part of it, because basically the premise of that is checking for gaps in their care and seeing like, look, this person is at high risk because of various reasons. Are they on a course of statins currently, and do they need to be? And making sure that those patients have the medical support that they need. But it's interesting that they also in this article talk about it from a cost saving perspective as well. At the end of the day, these things, if they work effectively from a preventative health point of view, are going to save someone money somewhere down the line. And here it says that they mainly sell to employers and health plans and insurers, things like that. Saying that they save an average of $1,700 per member with hypertension a year. And that's according to a peer-reviewed study of 7,000 members. So pretty robust, I'd say. And like you say, that's presumably measured in terms of avoided appointments that members would have had without the use of this platform. So yeah, it's really interesting. And they said CVS Caremark has found that taking medication consistently saved nearly $4,000 per hypertensive member per year and avoided 2 hospital days. So the cost savings here are potentially massive. So many people live with heart disease. And really, all I know about it is, you take statins for the rest of your life, and that sort of seems it. And I can imagine a bit of disillusionment at some point down the line, being like, well, I'm still taking statins and I'm still at risk of heart disease. So, something that feels more engaging, and you've got those touch points with clinicians and with your pharmacy as well, I think feels like quite an empowering move.
I think so as well. I take back the initial statement there. I'll admit that I read the wrong article and I hadn't read the Hello Heart one, so that's why at first I was like, what does this actually do? But with the additional context, absolutely, it's I think that's a really interesting use case.
Nice. So yeah, look out for Hello Heart potentially potentially coming to you. I think it's, as I said, it's selling into insurers and healthcare providers and things like that. So it seems that probably through workplace health plans is the way that most people are going to access this in the first instance. But these things, if they do show that value, you'd hope to see a scenario where they start selling into hospitals or into GP services or PCNs or things like that as well. So anything to sort of roll this out to a larger cohort of people, assuming that we see that benefit. But obviously there is a cost here. But the fact that they can show that ROI is wonderful. So yeah, maybe the future of heart disease management looks a little bit more high tech than it has for the last few decades.
Absolutely.
Thank you so much for joining me today, Harry. Really appreciate the conversation. And thank you everyone for tuning in. Be sure to check out the latest updates in Healthtech Pigeon coming to you this Sunday. If you're interested in biotech, check out our sister publication as well, which is Biotech Dodo, which goes out on Saturdays. Other than that, thanks for your time and see you next week. Bye.